So we'll be covering what is the Health and Wellness Grants opportunity. It's a new opportunity we just launched last week. And the collaboration grants is our focus for today. So essentially there's two, we'll go into more detail, but there's two opportunities that are pushed together into one. And that was really on purpose, that we wanted to have both the collaboration grants and these smaller seed grants for emerging programs and organizations. So before we do that, I'm just going to go through the agenda. If you could go to the next slide. What we want to leave a lot of time for is answering any questions you have, either about the content, community, or how to navigate through our grants portal. We're just a year into using our new grants portal, and so we know sometimes like getting around our new system can lead to some questions. So what we're going to do is go over the funding opportunity. That will be the first section, and then open it up to questions and answers. Then we'll actually have Nanda Freeman do a presentation sharing a little bit like how to navigate our grants portal and how to apply, getting started now. And then at the very end, we'll open it up again for questions and answers. That could be either grants portal or the question and answer portion. So with that, you can next slide. I wanted to let you know who's in the room from the Hawaiʻi Community Foundation team. All 5 of us are here in the room, and they're probably folks that you'll be interacting with through this grants program. I'm Justina. I'm the team lead of the health and wellness sector work at the Hawaiʻi Community Foundation, and I'm joined with an awesome group. We've got Patricia Marbeos, who's a program officer with us, and Malia Mayer, who just recently joined us as a program officer. We've got Jarissa Lung, who is a program associate, and you may most frequently recognize her. She helps us with a lot of our communications out to grantees, to partners about events and gatherings. And also we have Nanda Freeman, who's a senior program associate with us, and she'll be presenting at the last part. She's really our internal, I guess I would say, like knowledge expert on how to not navigate the grants portal, even for us as team members. So you'll see their faces around in the room, and feel free to also pop your questions into chat as they come up. Both Trisha and Nanda are helping to monitor the chat today. So if we can go to the next slide. I wanted to give a little background on some of this. I see a lot of familiar faces, so some of this is going to be really reminder and kind of a refresher on what is the Hawaiʻi Communities Foundation and this change framework that we've been working to adopt for the last 4 years. And for others, it might be a little newer. So we have organized ourselves around the change sectors. These are the 6 sectors in Hawaii that we really think it takes for people and place in Hawaii to thrive. There are a lot of intersections between these issue areas, and one of the real key undergirding values and principles of change is both the intersections, but we're doing this in a way working in partnership with people by using shared data to get to shared goals and outcomes, and really moving together in the same direction to make progress and social change in Hawaii. So where we're situated today, although all these sectors have work underway and have been doing work in the community convening space, we're focused in on the health and wellness sector. So I'm going to share a little bit more about what we've been up to for the last year and what was basically the genesis for this grants program. From May through basically May of 2022 through February of 2023, we've been asking each other, asking community, and gathering together to kind of look at what are the big contributors to health and wellness in Hawaii. What are the current like inhibitors or detractors, maybe things that need to get addressed, and most importantly, really understanding what are people's highest hope for health and wellness in Hawaii over the next 10 years. So we've been doing this in a couple of different ways. I'm really proud that we've had, and we have had a lot of people can be contributors to this. So 189 people unduplicated, which meant that people have been very generous with their time. So they not only maybe came to one session where we gathered input, but have come to multiple, or also kind of raised up their hand and said, like, I'll help you with some of those input into your draft vision statements and things that we've been trying to develop as a health and wellness sector. I see many of those faces actually here on the call. So thank you again for the time you've spent from March through February of this year. We've done everything in that kind of in 3 buckets. So the first bucket there is the community listening sessions that we've done. We've done these across our neighbor islands. It was really important for us to get to Hawaiʻi Island and to Maui. We wanted to have a place where we could be together with partners and kind of think out loud about wellness. We've also then, gone out with our initial straw man, like, what is this vision statement from all that we've heard for the health and wellness sector, and shared it back out with several groups to get a sense of like, what resonated, what should we change, and can you see yourself and your organization in this work? We've also done things like, we're a very rich sector in terms of data for health and wellness. So doing a data scan and seeing what we have available, and also doing what we kind of call the literature review light, understanding what were some of the key themes, and then what research do we already have that backs that up. And then also sourcing creative ways for participation. So I was recently reading something that said sort of like through art and through creativity is actually where some of the best ideas and solutions come from. And so I think in that spirit, we've also tried to do things that aren't just the conversation. So in that sourcing creative participation, things like filling in a vision statement, or what does shows a picture that represents health and wellness for the next 10 years for Hawaii's families. So those have been also real data that we've been using to gather and guide what both what we see happening in the health and wellness sector, and it will also guide and inform the work of the Hawaiʻi Community Foundation. And one of the very first ways of really guiding our work at the Hawaiʻi Community Foundation is through the release of this grants opportunity. We wanted to basically take what became this vision statement and use that as our guidepost for what kinds of organizations and projects and programs we'd be looking to fund. So this is where we landed with the vision statement after all that work with community convenings and different people, different iterations of the initial draft. And I think it's important to kind of slow down and read it. So in 10 years, health and wellness has shifted from fixing the individual to supporting changes identified and led by communities across Hawaiʻi. These shifts will impact the overall ecosystem of health in places where people live, connect, work, and play. Shifting agency, resources, and decision-making to community members closest to the solution creates a more resilient, equitable, and secure Hawaiʻi. I think the core in that piece is really shifting where the decision making is happening, and the power really to the community level around health and wellness work. And that's the work that we're trying to honor through this grant program. And we know we might not get it perfectly the first time, but we're moving in that direction and trying to do things a little bit differently. I also wanted to just call out, you can see more of this, what we learned through the last year and the what was really lifted up in terms of themes and the vision statement in the health and wellness sector summary of findings deck. And you can find that on the website for this grant opportunity. It's a PDF document, but it has really rich information, very simple to go through. It shouldn't take more than 10 minutes to kind of put your eyes on it. And in that, you'll also see that part of the vision statement was also designed as a social ecological model, really built off of what is important to look at through a public health lens. So not only do we have this overarching vision statement, but under there really trying to lift up what in 10 years it might look like for the interpersonal relationships. What would it look like for the community and societal relationships? community and societal levels. And that community level and the society level of health and wellness is really what we're trying to move towards. And so that's something that I think is important if you're thinking about applying for this grant opportunity, to familiarize yourself with what we heard from many community stakeholders. And I'll give you a preview of two of those kind of summary of themes from what we learned and what was lifted up for us in conversations. The first is what I'm calling the promising approaches identified by community. These basically are ideas for the how. We really took these in to figure out in the grants program that we're setting up, both for the collaboration grants and the seed grants, how could these be reflected in that grant opportunity? And so we're really looking to resource collaborative projects. We heard loud and clear that people would like flexible funding and through transparent, trust-based philanthropy. That's the third bullet there. One way that we're trying to do that is, as much as possible, providing general support. We are working with some constraints of field of interest funding that we're going to be matching to grantee, basically grantee issue areas. But as much as possible, we will be doing general operating support. And we also tried to make it clear some of the funding, some of the field of interest funds that we are working with. So at the very back of the funding opportunity document, you'll see an appendix where we list some of the actual funds where we're collating all of this, the funding that could be available in the health and wellness grant funding program, and kind of give you a sense of what are some of the priority areas or focus areas of those funds. So that could be another great resource to look at. So I think with that, this is a list really of the themes we heard, not just one time, but multiple times through different meetings, events, also through different types of sourcing of information, sometimes through what people wrote to us. So just, again, these are really helpful pieces as you're thinking about the work. I wanted to call your attention towards the end. There's several of them focus on that shift that's towards the community decision making, and also sort of the shared goals, the shared accountability across maybe different partners working together. Okay, I think we can go on to the next one because I want to make sure we're leaving enough time for your questions. After this, we'll be going into a little bit about what the actual funding opportunity is, and then after understanding the key dates, we'll open up to questions and answers. So start thinking about what questions you might have. Ask us. So this is the other big themes that came out of the community conversations, the community convenings that we had. We're calling these the promising strategies identified by the community, and we're using these 5 strategies that were identified over and over as ones that we'd like to basically resource and see what we can learn alongside grantee partners or making progress towards that 10-year vision statement. So the first is providing better data and information. The second is growing the health and wellness sector workforce. And what we mean by that is not just thinking about our healthcare workforce, so say people who work in hospital, clinical settings, but we are talking about the broader workforce that's working on well-being, including ones that you might not necessarily think of right away, but say INA-based programs or things that are striving at a more indigenous perspective of health and wellness. The third there is addressing mental and behavioral health. This was a very strong theme that came out from community conversations, even if one thing that was quite interesting is even if there wasn't anyone who kind of quote unquote was a mental health specialist that attended a session, almost every single conversation led into some conversation about the importance of addressing mental and behavioral health and really making that part of our health and wellness system in Hawaiʻi. The fourth there is increasing holistic and community-based health and wellness options. So again, this idea of community-led, community-driven, individual and collective determination about what health is in their community. And the fifth is involving communities in the decision-making. So decision-making about the health and wellness for their area, for their community, for their own family. So I hope these help serve as kind of a guide of the kinds of things we'd like to learn alongside grantee partners and some of the projects, programs, and opportunities that we're hoping to support and resource through this grants opportunity. With that, I want to turn it over to Tricia, and she's actually going to walk us through the funding opportunity and eligibility.
Thanks, Justina. Hi, everyone. Good morning. Nice to see some familiar faces and names. So really quickly, we'll just go through, all of this is already on the RFP, but just, give you guys a little more time to process and ask us any questions. So for the collaboration grant eligibility, we are expecting to award a maximum amount of $50,000 for a one-year grant. We expect to be able to award about 11 to 14 organizations, give or take. So really the organizations that we're looking for are committed to supporting the positive changes. Just say hi. Of the ecosystem. You must be a nonprofit organization with a 501c3 status and provide service in Hawaii. If you have any past due final reports from us from previous grants, you will not be eligible to apply. So go check those now and make sure you have everything in. And you can only submit one application for your organization. If you are a fiscal sponsor for another smaller organization or another program, you can also be a fiscal sponsor as well as submit an application for this collaboration grant. So we really want to make sure that your program aligns with our health and wellness vision statement, as well as implement one of the 5 strategies that Justina just mentioned. So the providing better data and information, growing health and wellness workforce, addressing mental and behavioral health, increasing holistic and community-based health and wellness options, and then involving communities in decision-making. We would like that your organization gathers data and tracks that that impact and progress towards your goal within our within our sector, and that your organization uses data to improve your program and collaborative efforts. I think most of you know, but HCF is committed to advancing equity. So we'll support organizations that are focused on addressing those organizations that focus on the greatest disparities within our community. We also hope that the organization will collaborate with others to better fulfill their mission, or leads, participates in a network that are, have a collective of organizations that will work towards a common goal, hopefully to foster some systems change within our community. And then the last slide is really for it's pretty specific for fiscal sponsor. So if you are going to be a fiscal sponsor for an organization, there are forms, and mahalo to Jarissa for beating me to it and putting it in the chat already. So there are some forms that will need to be filled out. We do need to see that your fiscal sponsor is a 501c3. And just, there's just a couple of other forms and things that need to be filled out. I think Nanda will be going over that because that's pretty specific in the grants portal that you'll need to fill out. So with that, I'm going to pass it on to Jarissa, who will go over some of our key dates. Thanks, everyone.
Thanks, Tricia. So our application was released May 15th, and the most important is our deadline, which will be July 7th at 4 p.m. It's a cutoff based on our system, so I would suggest that you get it in a little earlier than 4. The grant start date is October 2nd, and we'll have one in-person grantee gathering tentatively January 31st from 9 to 1 p.m. And our grant end date will be October 1st of the 2024 year.
Thanks, Sharissa. So I think we're gonna go through any questions. I think we have a couple that came in, right, Justina?
Yeah, I can start. So as people are thinking of their questions, you guys can either raise your hand using gestures, or if that's not working for you, pop your name in chat, or we'll happy to just have you unmute and kind of chime in if none of those options work for you. So I did just want to share one of the pre-registration questions we got in as people were registering to attend this information session today. Thought it was a really great one to also go over with the full group, because it might be a question that you're having too. So there's kind of two related questions here. So the first is, describe your expectations for collaboration. So we'll respond to that a little bit, and I'll combine it with the answer. Will HCF require any evidence of collaboration or partnership, such as formal letter of commitment that might be like an MOU or MOA as part of the application? So I'll answer both of those. What I added to this slide here is just something I wanted to share of, we're looking on people, there is a large continuum of collaboration ranging from, are you communicating with each other and other organizations, other individuals that might be working in similar spaces? The general kind of idea for that is like, hey, we're getting together, having lunch and sharing information. So we're looking for increasing levels of collaboration, kind of moving from the left-hand side of this slide all the way to the right-hand side. So moving from maybe it's a cooperation type of relationship where you're working together on one piece of work that maybe could have been duplicative if you weren't working together. Moving up towards coordination. So it might be coordination of services, again, to make it easier for people to navigate if it's a direct service, or coordination maybe on like advocacy or policy efforts together. And collaboration really signifies that there's like that multi-stakeholder engagement, and it's not just like led by one organization that's sort of telling others what the process is or what to do. We want to look at that multi-directional ways that people are engaged and collaborating, and then moving through even like integration. So are there, do you really have representation of those with lived experience of peers, and are those voices integrated into your collaboration and the work, and how is it moving forward? So I just wanted to, for me, I'm a real visual learner, so I think thinking about collaboration on a continuum is helpful as we're thinking about the types of programs and organizations we'd like to be resourcing through this grant opportunity. And then to answer the second part of the question more specifically, in the actual application, we won't be requiring any formal uploads or documentation of like a actual established MOA or MOU, but we do ask that people talk about the ways that they're, and maybe where they are on this spectrum of collaboration. Could be an example of it, like how are you actually working in partnership with other people, other organizations. And the reason we're not requiring, say, a specific evidence is many collaborations aren't, documented through a formal MOA and MOU, but it doesn't mean that there isn't an established culture of collaboration. We want to hear about what that means and how you guys are doing that work together. Okay, so let me open it up. Who wants to be the brave soul who asked the first question? Sometimes that's the hardest one to just get going.
I don't mind. So my name's Jana Bogues. I'm from the Big Island, and I have a background in nutrition. And then I came to realize that our foods are not what they could be or should be anymore, that we had lost food nutrient content, and that was shown through several studies. So it's been my life's work to improve the quality of nutrition, starting with soil. And now I work with farmers and gardeners and help them grow more nutritious foods. And just more yields, better for the farmers, just overall being able to produce more foods. And wondering if this is something that I could apply for, this particular grant. And
Yeah.
whether, get your feedback on that.
Yeah, thanks, Jana, for asking that question. I think one, definitely the pieces around like the connection to the health of land, health of Aina, has come up as also being important for health of people and wellness of people. So I think thinking maybe about it in that realm, I would encourage you to look at especially that list of the 5 themes that we shared. Maybe we'll pull them back up in a little bit, to just say like, does the program or organization or the project that I'm sort of thinking of, does it match one of these, or could I sort of see it progressing for the vision statement? So I hope that helps give a little bit of guidance. I see Deb with her hand up. You can ask your question next.
Thanks, Justina. I'm wondering, is lobbying an allowable expense, or will it be silent on the matter where we may, and just if that's allowable?
Yeah, great question, Deb. Giving us a good hard one. So with general operating support, it's not going for any particular, organizations can choose to use it to make sure that they have light bulbs that are operational in their facilities. They can use it for paying staff or like extra professional development, many different uses. And within that, I think the only thing to consider with lobbying is just making sure that these grant funds aren't your only source of funds that are being used for lobbying. And let me do a little bit more digging, Deb, because I will want to answer that a little more clearly on specific use for this. And it's something we can clarify in an FAQ statement.
I think Francis is next.
Thank you. I'm Francis Chan from Hawaiʻi Health Information Exchange. And in the earlier continuum that was shown about communications, I guess the last step, of course, is integration. So I wonder, with this grant, if an application to this grant is for some technology or technical solution implementation, does that still fall within the context of improving data and is that still part of that, or do you consider that as out of scope for this grant application? So I just wonder about that, because that's what we do, right? Integrating data, pulling data in, and then the final step, of course, it's integrating different sources of data. So I wonder if you can shed some light on that.
Yeah, I can take this one, Justina. Yes, I think you would just have to demonstrate how that data, is really going to benefit the larger health and wellness community. But I think that's, what we need is better data and information, especially for our minority populations and our smaller communities in Hawaii. So, yeah.
Thank you.
Thanks for that question, Francis. I'll turn it to Lauren. The one last thing I wanted to add, Francis, about your question is also maybe a little bit of the how, like how is the data, like what's in the data getting determined. So some of it is the process piece behind the data versus just having the good data. So with that, let me have Lauren ask her question.
Hi guys, I was wondering if we could use some of the funding to get our staff endorsed, infant mental health endorsement. We have a lot of staff who are really interested in it this year.
Yeah, that's a great question. I don't see any reason it wouldn't be allowable, and to the like I was mentioning earlier, to the most extent possible, we'll be trying to provide general operating support. There will be some funding that has specific purposes. But one thing to be transparent about is actually several of our funds at the Hawaiʻi Community Foundation do have mental health as one of the primary purposes. So I actually think that that could really be a fit if it's something that you guys are identifying in your work, your community work that you're seeing as a need. Robert, I see your hand up next.
Yes, hi. My question is on metrics. I remember the current or this previous iteration of the change grant. There was a list of metrics that were part of the reporting process that we had to fill in as best as we could. So in this iteration, in this round, can we expect to see a set like a data a set of metrics that we would be providing data to, or are we going to be able to create our own metrics based on specific to the project that we're working on, or does it still have to be tied to the larger, I guess, menu set of metrics that we can choose from?
Great question, Robert. So I'll take it, and Tricia, especially because you've done a lot of thinking about data, if you want to add anything, do go ahead. So with this work, what Robert is referencing is also we're building off of the work that was the 2021-2022 change grants program. And so that's the work he's referencing in terms of like a report that had many different things to fill in, and what we're trying to do both through those progress reports and the final report is a lot of learning. So we're working with the Hawaiʻi Data Collaborative. They're a core partner of ours in the change framework. And so that was what we've done in the past. I guess what popped into my mind is maybe you guys will now know I've been watching too much Ted Lasso, but the phrase of be a goldfish. So in a little bit, we're being a goldfish in terms of they don't remember a lot and then they get to start afresh. And isn't that just very refreshing? We're not going to be requiring that type of input. What we're thinking about for the reporting is we want to really learn alongside grantees about the progress towards those five areas that were mentioned, like 5 things that people really see as making an impact towards the long-term health and wellness vision statement for our whole sector. And I think the other piece I just really want to bring in, so Robert, if you bring up data, then we're going to start putting you on a wonderful list to get invited to join us in a conversation with the Hawaiʻi Data Collaborative and HCF, because one of the things we're actually, what we've really recognized in these conversations with community is we don't currently have the right kinds of data that we really want to understand, like how can we assess community level health? How do communities want to assess their own health and wellness, and how is it going? And so that's a big, interesting project and something that we're working on with the Hawaiʻi Data Collaborative. So I hope you don't mind, Robert, but I'm jotting your name down to be on that invite list because we're starting a couple conversations about what this should look like and what do people want it to look like in terms of shared data that we might look at.
Thank you, and help me in. Thank you.
Okay, thanks.
I think I also, just to add, see, look, now just, nobody's going to answer questioning because they're going to get assigned committees and things. But I think, like Justina mentioned, we don't really know what the best data is to collect. So this is really an opportunity for the organizations to show us what you do collect and to show how you have measured change or progress within your own communities. So this is the kind of like a two-way learning street for us. We want to see what you guys have and what you collect. And then also, we can reflect back, what we're understanding and from the data that you're sharing with us. So I think that's, yeah.
Thank you.
Thanks, Robert. Hi, Tanya.
Hello, everyone. Okay, so I have a couple quick questions about like examples of maybe specific expenses that would be allowed or maybe that would not be allowed, because for example, like if there's no dementia certified experts, training experts in East Hawaii, possibly not even on Hawaiʻi Island at this time. So, if we were to provide that training for our staff and then offered it up to the community for other organizations and agencies to get trained as well, is that something that would be allowed? Or even to, like, we know that the data we're collecting on our participants and our kupuna is really solid, but we need more data on our caregivers and the impact we have on caregivers. So is there funds for like, staffing so that we can secure more data so that we have a more meaningful, we just need to get more meaningful data, but so that we can collaborate. And then also, you know, we're in the beginning steps of collaborating with other agencies so that we're not duplicating services anymore, so that we can all get really good at. And so, you know, sometimes those expenses are really just part of like the executive director's time and things like that. So I'm just looking for a little more guidance on like what you guys would feel is acceptable, what's not acceptable.
Yeah, so I think I heard like maybe 3 different types of expenses that you're asking about. So the first one was like staff training and maybe almost like a train the trainer kind of model, so that those trainers can then go and train others in the community. And I think that that's absolutely an allowable expense. And then I think the other 2 were basically staff time to collect data and maybe other staff time, executive director level, to attend collaboration meetings as well. So I think Justina kind of mentioned in the beginning that, you know, we are, as much as we are hoping that these funds can be used for general operating costs, you know, as much as possible, some might need to be tied to specific programs or projects, but even if they were, staff time is definitely an allowable expense. So I think everything that you're asking is fine. Justina, anything to add?
No, you covered it perfectly, Trisha. Thanks for taking that one.
Thank you, guys.
I think in the interest of time, I want to, we'll have more time again for questions and answers, but I do want to also have Nanda be able to really show you guys the grants portal and take any questions about how you actually will navigate and apply. And so if you do have other questions, you can pop them in chat. We'll try to respond to them as we go, or just hold them at till the end, and we'll have a few more, at least 5 minutes, if not 10 minutes for questions. So with that, Nanda, could you help with the grants portal presentation? Oh, was she having?
Yeah, I see that she's off mute, but we can't hear you. Uh-oh.
Okay, well, maybe while Nanda's getting her audio sorted out, and we'll see if we can get her so we can hear her. Are there any other questions that we could answer? Now you don't have to wait till the end, you can just ask them. I did see one that I wanted to lift up. We actually also got this at our first info session we did last week. So one of the questions was, can you apply for multiple applications if your organization is applying for, you know, itself in a collaboration grant, but you also may have a you're fiscally sponsoring another organization that's applying? And the answer to that is yes. So we can, there's definitely ability in the system to have multiple applications. It'd be for one organization if you're sort of applying for that collaboration grant, but we also understand many of our organizations and nonprofits, you know, several I see on the call do serve in that fiscal sponsor role for some of our emerging projects and programs, and those are really important ones that we want to be funding through our seed grant opportunities. So it is absolutely allowable to then also be the fiscal sponsor for another organization or project. Okay, Nanda, any luck getting your audio back working?
Justine, I think her computer is going a little crazy. So I think she's almost on, but I think we can pull up the presentation, Jerissa.
And then to just sign right now.
She just came back on.
So how's everybody doing? I am uncomfortable with silence. This is probably laughing at me. Wednesday.
Okay.
Okay. Yay. There's Nanda.
No, I can't mute my other computer.
Zoom is always keeping us on our toes, I have to say, you know, you can never predict what it's gonna do. All right, Nanda, we're ready for you.
Okay. Can we hear me and not have a weird echo?
Yeah,
Yes,
can hear you
we
great
muted
now.
your other self.
Thank you. No, I know my sound is on my work computer and I can't turn it off. It's gonna be a fun day, you guys. So thank you so much for bearing with me right there. Today I'm going to walk you through a little bit of the applicant user guide and some of our resources that we have for you in the grants portal at HCF. Some of this might be repeat for some people. I apologize and thank you so much for your patience. So to start, I just want to show you where you can find some resources. If you are not sure where to get started, you're going to start on our website at HCF. So if you log into HCF, the Hawaii Community Foundation.org, you're going to find, or .com, you're going to find these options and headers. So you'll click the grants and scholarships header. And then all of your resources for the grants portal is going to be right in that how to apply for a grant link. So just below in the next screenshot, you're going to see what that page looks like. So we have linked here, we have your user guide, which is going to be really helpful. I always recommend you open it while you work. And it's good to know where this lives because we do update it frequently. So as we have a lot of the same questions come in, we try and update it as we can. So don't just save a copy, always come back. You can bookmark it, but you do want to save a copy for yourself. You can also access our frequently asked questions. And when in doubt, support tickets are going to be your best friend. So they're linked on this page, they're linked on the grants portal application or on the login screen. It's linked throughout the application and the portal. So remember, if you're stuck, you can't figure it out, don't get frustrated, submit a support ticket. And then finally on this page is also a number of videos. So these are going to be videos for common processes that you'll go through. So we have walkthroughs, we have, oh, thanks Jerissa. Jerissa just posted this in the chat. So it's just going to have a lot of very useful resources for you to have kind of tools for your tool belt. And remember, if you can't find the answer, don't wait until you get frustrated. Submit a support ticket. All right, next page. Thanks, Jerissa. So on the login screen of the grants portal, which you can access anytime, you're going to see that the same resources are linked here. So we have the user guide, we have the frequently asked questions. That link to the website will take you right back to that page I just talked to you about. And when in doubt, support ticket link. I wanted to give you some basic tips today. So if you're getting started and you haven't used the portal, even if you have used the portal, you want to make sure that you're using Google Chrome or Mozilla Firefox as your primary. Oh, everyone is frozen. Can you guys hear me still? Okay, good. Sorry. So you want to make sure that your primary browser is Google Chrome or Firefox. It just works better with the system. Internet Explorer, Edge, Safari, they all have their own kind of unique challenges. So if you do only have those and you need help, let me know. You can submit that support ticket as needed. So if you are setting up an account for the first time or you haven't logged in for a while, so your password has expired, what I do recommend is that you hit that forgot password link or you register, and it takes a maximum of 10 minutes to get your reset password link. So it'll be in your inbox or your junk folder. If it's not there, please don't wait. It's not going to come. It means something has stopped it from coming to you. So in order to help you get into the system, just submit a support ticket and I can help figure out what's happening with the system or with your account. Jerissa, go ahead and go to the next screen. Okay, so this is what the portal looks like. So that top left screenshot is what your dashboard is going to look like. And highlighted in green is your organization profile. This is really important. There's every application that you complete at HCF is kind of two parts. One is the annual organization profile update. If you have not updated your profile for another grant round, or you haven't updated it and certified it in the last year, you are going to need to complete the org profile again and recertify and make sure everything is up to date. So whether you're new or you're in the system a lot, just double check and make sure this is done early. You don't even if you're not ready to apply for this specific grant, if you're looking at any HCF grants, I just recommend after this call, log in, get your application or get your account set up and get your org profile completed or review what's there. This is important because you cannot submit an application without having the org profile complete. And sometimes people will wait until 3:55 and they try and submit their application and they get an error that says your org profile isn't active. And that's because it hasn't been submitted or recertified or certified if needed. So that is kind of my key point. Do not wait until the last minute. So you can get logged in and familiarize yourself right as early as now. You could be doing it at this moment. The second step to starting an application is by clicking that open funding opportunities link highlighted in yellow. And on your dashboard, they're not going to be highlighted. I just highlighted them for you here for easy access. So that's going to pop up the screenshot below where you can see the name of the funding opportunity, a short description, the deadline. And then if you want to download the funding opportunity guidelines, they can be downloaded by clicking that button that says download. And to start the application, just click apply, and that will start the process for you. You could go to the next page, Darissa. Okay, registration options. I did want to talk about this just a little bit. So if you have not ever accessed the grants portal, you'll need to register for an account. It may be that you get an error that says there's an account with your email address already. If you get that, go ahead and just back up and go ahead and click the forgot password link, and it should send you a new password. If you know your organization is already set up in the system, use the organization contact registration option. If you're a brand new 501c3 charity that's not in our system, you can click 501c3 charity. And other organization is going to be for those organizations or programs that are either not nonprofits or they're programs and projects that don't have that nonprofit status. So you'll probably, in most cases, organizations will be using fiscal sponsors. If you are a very new 501c3, like very new in the last couple of months, you might not show up in the dropdown for the 501c3 charity because that does bounce off of an IRS website. And sometimes it just takes some time to get into the system. So if that's the case, go ahead and submit a support ticket or use other organization to get set up. Okay, next page, just Darissa. Oh, and sorry, Darissa, could you actually go back a page? Sorry, also, you can see one of the instances, if you look up at the top, there's this little information box and you'll see where it's in blue, it says support ticket. That is where you can click and submit a support ticket to come to get assistance. So you don't have to, if when in doubt, click any of the links that say support ticket throughout the portal. Okay, thanks, Darissa. I did want to go over instructions for fiscal sponsors just because it's very important that you guys know this, especially if you are applying with a fiscal sponsor. So the sponsored organization is usually not a 501c3 charity. So you're going to be using that other organization registration button. And once you fill out that form, you'll go in, you'll complete your org profile as best as you can. And then one thing to know is that if you are using a fiscal sponsor, their organization profile also has to be set up in the system. So it needs to be in the system and it needs to be completed. So it also has to be certified and submitted, and it has to be up to date. So if they're not in the system, they will be registering using 501c3 charity. And all fiscal sponsor organizations and sponsored organizations have to have those org profiles submitted, or you're going to get an error for both of them as you try and submit. So if that ends up happening, I just recommend far in advance, if you know who your fiscal sponsor is going to be and you want to check on their org profile status, you can submit a profile, you can submit a support ticket, and I can double check that for you. And if someone needs to be notified, I can give you the contact name on the portal so that you can communicate with them to get that updated. Thanks, Darissa. Next page, please. So this is just the last, it is a very particular, there are definitely reminders that we want you to keep in mind if you're using fiscal sponsors. So when you're applying in the program overview, you do need to select yes to the fiscal sponsor question. And then you're going to type the legal name of the organization and it'll basically pop down in the list below where you can select it. If it's not showing up, make sure that what you're typing is the full legal name. Make sure it's not using any acronyms or shorthand. Make sure there are no diacriticals in this field. It needs to be as it exists in the IRS database. And if you can't find them at all, that probably means that they're not in the system, and you can either reach out to them for confirmation, or again, you can submit a support ticket and I can verify on our end for you. And then just a reminder is that if you are using a fiscal sponsor, as Trisha had mentioned before, don't forget to upload the resolution and agreement forms. Okay, Teresa. So here are your 3 takeaways. I know that is so much information. So the 3 things that you want to remember. 1, do not wait until the last minute to get started. I really do recommend that you, if you're interested at all in the portal, you can see all of our open funding opportunities in one place. You can get all the information you need, and it's just really good to have that org profile set up and done so that you don't have to worry about it last minute before the application is needs to be completed. Second is complete that org profile right away. And number 3 is submit a support ticket if you can't figure something out. Please don't wait until you're frustrated. I don't want you to be trying to do something over and over and over and just having it error out. You can always let us know, and we can, if you submit the support ticket, we can always assist you in a pretty timely fashion. I know it's a 2 to 3 day technical response time, but I do usually get back to people within 1 business day. So I should be able to help you, as long as we're not super close to a deadline where lots of tickets are being submitted, then it takes a little bit longer sometimes. And that's it.
Thanks, Nanda, for giving that overview of the grants portal so people can be really comfortable with even just getting started and knowing how to apply. We have about 6 minutes left, so if there's any additional questions people want to ask now and get them live answered, this is the time. So opening it back up to any questions from you all on the call. Well, this is good. We might have gotten them all answered in the middle part. So again, do feel free to get kind of started on the opportunity in the grants portal if you think you want to apply, and you can reach out to Jerissa, who's going to be our main point of contact for gathering. If there's any additional questions about the grant opportunity, she'll make sure it gets answered by one of us on the health and wellness team. She's just hoping to make sure we're collecting all the questions, and we will be starting a frequently asked questions, just because sometimes the question you ask, other organizations would want to know the same thing. Okay, do you see there's one question, Cynthia? Oh,
Yes,
there you are. First, I couldn't see.
Almost forgot. I thought this question a long time ago and I almost forgot. But yeah, now is this for new programs or can you ask for funding for existing programs?
It can definitely be for existing programs and collaborative work that's happening already. It does not need to be creating something new.
Thank you.
Okay, well, I think hopefully that was a helpful overview. We're so glad that you joined us today, midweek on Wednesday. And I hope that you have a great rest of your week. And I do hope, if it seems like a good fit, that you consider applying. Mahalo for your time. Aloha.